In a quieter time and place, Professor Sharfstein of the Bloomberg School of Public Health at Johns Hopkins University would write essays like Influenza Vaccination and Migration at the U.S. Southern Border. Right now, he's focused on the pandemic in hospitals in Baltimore. We're thrilled that Joshua Sharfstein could join us this morning. I should point out also that Mr. Bloomberg, the founder of Bloomberg LP and this radio and television shop as well, has been a philanthropist for his Johns Hopkins University. Joshua, wonderful to catch up with you again. Through the theme of the week that Francine and I have seen is we're really beginning to see some constructive news of getting over the hump. Translate that into real-world medicine. Are we anywhere near over the hump? Are we anywhere near a glimmer of hope?
Well, what we have seen recently in the United States is a plateau, and that is good news because we clearly were worried about having so many people with severe disease from COVID that it would overwhelm the healthcare system. And there's no question that the healthcare system in several places, such as New York City, has been pushed really up to the brink, but there's just been an amazing medical response and extra beds and ventilators and staff coming in, and it looks like the line there is more or less holding, and these hospitals are not getting overwhelmed. So that is a very good news. However, it does not mean that, it's all over. It means that really the long-term battle is beginning, and it's very important that not only the current restrictions continue long enough for cases to really begin to decline, but also that we have a strategy for slowly reopening the economy.
I had a family member over the weekend, Professor Sharfstein, who took in the information of a nurse of about age 40 dying. Why are nurses dying? Why are doctors dying?
Well, this has been seen all around the world, including in China and Italy and Spain, and it may have to do with the fact that they were exposed to a very large amount of virus, perhaps before it was known that there was coronavirus in their area, or when they were unable to get adequate protective equipment. And the amount of virus someone's exposed to generally can influence how well people can fight off the infection. So that's one possible reason why. The other reason is that there's a certain randomness to this virus. There are people in the community who seem completely at low risk based on what we know, but nonetheless, they get seriously ill or even die. So, this is not a guaranteed harmless infection for anyone.
Could this be genetic? I know there are a number of studies, Josh, about whether you have a pre-genetic disposition for the virus to get worse. Where are we on that?
It's possible. I haven't seen any compelling data specifying which genes. Sometimes there are variations in the immune system that can predict vulnerabilities to infection. So, I think that would be very interesting if it's uncovered.
I know you were saying that we need to be vigilant against a new surge of cases as we start to lift restrictions. What would be the right way to do this? Do you take a state and the state reopens and you see what happens? Or do you look at another country? Or countries and states comparable in how the response has been, how the lockdown has been, and the number of deaths and infections?
So I think there are two things, and there's been a couple of very good reports that have been put out, including by the Johns Hopkins Center for Health Security. And the first thing is you have to think about what are the conditions for reopening? What do you want to have in place before we reopen? And the second thing is how do you go about it? And in that first category, what do you want to have in place? Adequate testing, which we don't really yet have, to really be able to test people who are sick, even mildly ill. as well as enough testing for high-risk places like nursing homes. You certainly want to see cases declining substantially for 14 days. You need the public health capacity to respond to positive cases, and you need to make sure that that healthcare system that's been pushed to the brink in some areas has really bounced back so that you're able, if things get worse, to handle the challenge. And then you got to think about how you're going to open up, and it's not going to be flipping the switch back on. It's going to be slowly turning the dial, and you need to really think through what comes first, what comes second, what comes third, and in between each stage, waiting to make sure that you're not sparking a surge in cases. And there's some things that may be able to come first, like if there are workplaces where people don't sit anywhere near each other, but then there are things that are going to come later, like a big indoor concert that may come the latest of all. So you really need to be thoughtful about that. I think you're starting to see in the United States frameworks being discussed by governors, and I think that will be the roadmap that people follow.